coming from that perspective, there are three things that I want to create. Actually, before I get into that, I'll go a little bit more into the electronic health records, personal health records in the cloud, social media. I mentioned Google Health, Microsoft Health Vault. Both of those are allowing the patient to take control of their health records. You know, it's their responsibility to collect their records from their various providers, but then they're able to enter their information into one central record that they can share however they want. They can take personal responsibility for their health. They can track their fitness, their diet, medication that they're taking. The services are getting more robust so that they can see this medication may have an interaction with this other medication or this thing that is in my diet. So they can be more proactive about their own health. I think that is absolutely excellent. Practice Fusion is one of those health record providers that I saw last year at Health 2.0. One of the things that I really like about them is that their record is completely free. You can pay for it if you want, but you don't need to. It's an ad-supported model, so it's similar to the Google, Yahoo business model where ads come through. The ads that Practice Fusion supports are a little bit more subtle and practice relevant. You know, it's not Google ads that you're getting with the record, but it is a secure record. You don't have to have your own computer facility. It's in the cloud, so you're logging in like you would be logging into your Facebook page, for example. And that record is one that also allows integration with a personal health record. So the electronic health record that the provider maintains is the provider's. So it's not the patient's. You can choose to share the information with the patient. You can choose, if it's medically relevant, to share it with other providers. You can also choose what information gets shared. Sometimes if you have an insurance claim, there's medically relevant information that you're obligated to share. And then maybe there's irrelevant information that you don't have to share. So you can choose which parts of those records actually get shared out. There are a few other things in social media, in like next generation health records that are coming up. One thing last year that I saw was a Health 2.0 accelerator project. What that was a lot of different companies bringing their services together. So pharmaceutical integration would happen. You'd have a drug database, contraindications, what they would do, and then integration with the personal medical record, whether it's the electronic health record or the personal health record that the patient controls. There were some notification services, things that might be specific to diabetics, but getting a lot of different electronic services together to provide more streamlined care for the patient, making it much more patient-centric, allowing for the patient and the patient's care providers, whether it's a family member or a home health care nurse, whatever, to have faster, more complete access to what's going on with that patient and being able to take care of them more efficiently. And then we've got non-health related services that do have an effect on healthcare delivery. Facebook, Twitter, some social media, Yelp, for example, where you've got people recommending businesses. Foursquare is another one, which is a location-based service. So I'm not sure how sticky Foursquare is going to be, how long it's going to stick around, but the principle of that service is being integrated into Twitter, into Facebook, into other services, so that even if you're just carrying your phone around with you, it can automatically ping oh, I just stopped by General Hospital, or I just stopped by my massage therapist. So that marketers and your friends can get a profile of what you're doing. In some cases, can be a good thing. You can refer your friends to services that you're using if you wish. In some cases, it's a little bit scary, Big Brother-ish kind of thing. And in that Big Brother type situation, I think it's very important that we're aware that it exists and we know how to turn it off. Because usually it's an opt-in, and people just aren't aware that it's there. So they're going around broadcasting, oh, I went to my OBGYN today, if I were one. Which could be dangerous in some cases, especially in our current political environment. So that privacy aspect is something that we really have to be aware of. But at the same time, using social media like Facebook and Twitter creates new opportunities for people to create community around diabetes is one big thing that has come up. Exercise is another. Whether you're a runner or a cyclist or you're just going to the gym and working out, creating communities can create motivation for people so that they are, again, taking more responsibility for their health care. There are also educational and marketing opportunities for healthcare providers if they use these services in a smart way, in a responsible way. And then you also have to think about protecting patient privacy, how HIPAA compliance is going to be expanded to the social media sphere, and how practitioner ethics and responsibility will fall in. Some hospitals are being proactive about getting involved. Mayo Clinic, for example, in Wisconsin, is very proactive in the social media sphere, creating a private, internal network so that patients can go and interact with each other, but still complying with HIPAA. There are others that are doing it from the head, creating professional pages on Facebook and just running into the bumps and walls as they come up, as opposed to having a plan. And to a certain extent, it's very hard to plan with the way that Facebook and Twitter and that type of service has been developing, especially in the last couple of years. But at the same time, looking at patient privacy, professional ethics and responsibility, I think it is possible to create responsible boundaries so that we can take advantage of the opportunities without sacrificing patient care and privacy.